Hope you're good at that. All right. Well, this one really took us by surprise. This happened in Finland, about 150 people, 5 different hospitals. And some of them had like clicking in their knees. It locks up, real pain. Half of them they operated on, gave them a prescription and a therapy remedy. The other people, and they weren't under general anesthetic. Most people were awake for this, so they rubbed knives on their knees and made, I guess, operation sounds, gave them the same prescription, and then a year later, even those who still had clicking and locking said it worked for them. So as the BS detector, is this a good study?
This is a very well done study, and I think a study that would be very hard to reproduce in the United States. It would be hard to recruit patients for a study like this. I think that the big thing about this study is it does a very good job of showing that removing that torn piece of cartilage may not be the thing that improves patient symptoms. But I think it's important that people don't also extrapolate this to meaning that if you have a degenerative meniscus tear that no treatment will make it better as well. It doesn't do that. In both groups, the patients did have surgery. It's just that in the one group, the cartilage was removed, and in the other group, it wasn't. So there has to be more research done in the future as to what is the most important aspect of this study and why do patients get better in both groups.
It never occurred to me that surgical placebo would have this kind of effect. Can they just chalk it up to that? How do you account for all those people who say, yeah, I'm much better, I would do it again, even though there was nothing to be done again?
Well, I think there's two aspects to this. One is that the patients do want to live up to the expectations of a surgeon. So there is a placebo effect for surgery. It is different than a placebo effect for a pill. And I think the second part of this is that arthroscopy was performed on both groups of patients. So you are removing some enzymes and other proteins within the knee that can cause pain as well. So that's why I think it's really important that as this moves to the future that additional research occur, that we can isolate what was the most important factor in this study.
There's a whole host of doctors who think we overtest in this country, we overprescribe and overoperate. Do you think this is a symptom of that sort of thing? Are people, demanding the scope because they want to go full bore and get rid of that pain? Do you think doctors are guilty of doing this too much?
Well, I think most of my orthopedic colleagues here in the United States would, if a patient presented to them with a degenerative meniscal tear, most of us would do some form of conservative treatment first, whether it be medication, injections, or physical therapy before we would move to surgery. But there certainly is a subgroup of patients who would like to have that red badge of courage that they had surgery to help justify their pain or validate their pain, both to themselves but also their family members or friends and coworkers. So there is an aspect of that occurs, at least in our country, with these types of situations.
Right. Well, at least it's good to know that if you start with a little bit of therapy, some common sense, you can work your way up to that scope in the end. Doc, we appreciate your time tonight. Thanks for your insight.